where researchers could come and actually gain some skills on the bench. So we are partnering with trust partners all over the world, and we have carefully selected those who could actually meet our vision, that is affordability and also quality of the equipment and reagents that were to be shared in our region. So what is the direct impact that after 4 years of existence we have had? So we have been able to reach to 31 research centers that are accredited. With also, we have been able to sign a memorandum of understanding with state universities in the region, and also conduct more than 10 workshops that were organized in our premises. And the revenue that we got from these activities were reimbursed into a new unit that we have called the Share Lab, where now about 51 PhD and master students came to actually accomplish part of their work. So that's the way we did to actually increase accessibility to biotechnology and reagents in our region. Next slide. So this is the team here, a team made of young Africans from diverse origin, biotech, business, quality control management, and logistics. So I thank you for listening to me. Merci, you got the prices of some of our reagents there. Thank you.
Thank you so much. Thank you so much. Next up, we have Nawa Scientific. No? Oh, that's the one that's not presenting. That's the one. Okay, so we'll move on to Medimart. Medimart, is Medimart in the room? Excellent. Good luck. 5 minutes.
Okay, good afternoon, everyone. I am Oluwatobi Adeumi. All right, so I'll be talking about Medimart. Next slide. Next slide. All right, in Nigeria, we have more than 200 million population, and just about 50% have adequate access to healthcare products and services, according to WHO. Right, so these are some of the problems we have identified. Millions of individuals in Nigeria face limited access to safe, affordable, and reliable healthcare products. Also, there is time-consuming and challenging search of trustworthy vendors and providers, leading to wasted efforts, subpar options, and compromised healthcare choices. And one of the third challenges we've identified in Nigeria is that healthcare businesses in Nigeria struggle to expand their reach and connect to the broader customer base, hindering their growth potentials and leaving valuable market segments untapped. So what is our solution? A comprehensive online marketplace seamlessly connecting individuals with reliable vendors provider, eliminating limited access on affordability and misuse and business opportunities. And this is our product. This is our Medimart platform. It's an online marketplace where you have different categories of healthcare products and services. We have pharmaceuticals, we have personal care products, and a lot of that. And what is our product offering? Seamless access, of course, intelligent search, eliminating wasted time and frustration. And of course, we are offering growth opportunities for healthcare businesses by connecting them with a broader customer base, helping them to unlock untapped growth potentials and steering their success. And of course, we are building a trusted ecosystem of healthcare service providers and product vendors that our customers and, of course, businesses we're working with can get their product from. And, of course, we have our delivery and logistics services that get your product delivered to you same day you place the order. All right, we've not launched yet. We are still piloting our solution. So we started piloting February this year. And so far, we've been able to onboard 28 product vendors, including pharmaceuticals, and also medical equipment. And we've been able to serve 42 customers, piloting in Lagos, Nigeria. And from February till this time per month, we have 1,840 unique visitors on our website. All right, these are some of the networks and partners we currently have since we started piloting. And next slide, we have our theme, which consists of I, Oluwatobi Adewumi, and of course our software engineers, business developers, creatives, and next slide, other team members. Next slide. All right, we believe at Medimat that accessible healthcare is not a privilege, right, but it is a fundamental right for everyone. And Medimat empowers individuals to effortlessly access the care they deserve, bridging the gap between quality healthcare products and services for those in need. Thank you.
Thank you so much, Medimart. Next, we have Negus Med. Let's hear from Negus Med, please.
Yes, hello to everyone. Thank you for the opportunity. So I'm Dr. Austin Omune, CEO of Negus Med Limited. We are based in Kenya, serving the East African region. No problem. Yes. So Negus Med was started with the vision of increasing the standards of healthcare in Africa. So on the right, we have a young child. His name is Bill. So Bill presented to the hospital with acute appendicitis and required emergency surgical care. But due to the lack of equipment, he was not able to be treated and suffered further complications, resulting in him developing a large wound, open abdomen, keeping him in hospital for up to 6 months. So this is not an isolated case where a lot of patients in Africa suffer from prolonged suffering and even may lose their lives. So we can see that only 5% of hospitals have the advanced, adequate medical technology. And this is where we come in as Negus Med, where we've developed, next slide. We've developed a platform called CliniBuilds. So it's a medical device platform that enables healthcare institutions and healthcare givers access to groundbreaking advanced medical equipment through a therapy as a service model, where hospitals are able to co-use and co-finance advanced medical equipment and use them in a seamless manner. So this de-risks the capital acquisition of advanced medical equipment for healthcare givers and institutions, and also results in optimal resource utilization. And they are also able to co-exchange different medical equipments depending on their need and usage. So how does it work? We use something called health demand aggregation and simulation, where we cluster hospitals and clinics in a same geographical region and are able to analyze their critical equipment needs. And then we place the equipment, and with equipment mobility, they're able to use this equipment. So the patients are able to have a higher standard of care, and the institutions are able to increase their services, increasing their revenue. There are custom accounts for the hospitals to book this medical equipment, have visibility. Manufacturers also have customized accounts that give them the data intelligence to be able to enter their products into their market. And the therapy and service model and BNP and the buy now, pay later financing is due to blockchain encrypted investor wallet that facilitates the acquisition of this equipment. Next slide. So through this, we've been able to advance previously unavailable medical equipment in the market. increasing the standards of care, especially in surgical care. So you'd be able to receive the same quality of care in New York that you'd still be able to access it in East Africa. Next slide. So this is the technology block that we use with the health demand simulation and analysis powered by AI, and the blockchain encrypted fund, and the core purchase and core usage of this medical equipment. Next slide. So these are our different business model. With the therapy as a service model, meaning the patient will only pay 2% on the cost of acquisition of the equipment. So instead of hospitals having to buy expensive equipment, the cost is spread throughout the hospitals, enabling them to offer a higher service of care. So we're a team with diverse skill sets, led by myself, having been a medical doctor with experience of 5 years, and also other skill sets in business administration, logistics, and software development. Next. These are various partners who have been able to enable us to develop a product that is able to solve the problem of medical equipment access in the region. Next. So we've been able to have some traction where we have over 260 hospitals who are able to utilize this equipment, and this both in the public and private sector, as well as serving the largest public hospital in the East African region, and having been able to treat over 550,000 patients through this model. So patients like Bill do not have to suffer and stay in hospital for 6 months and can get the treatment they deserve. Next. So we'd like to welcome you to join us as we solve these problems in the entire supply chain of medical equipment, from the financing, the utilization, and also the access to this critical medical equipment, so that you can get the quality care that you need right here in Africa. Thank you.
All right. Thank you, Negesmed. Next up, we have 07 Therapy.
Thank you. My name is Ashraf Bakhit. I'm the founder and the CEO of 07 Therapy. What we do at 07 is that we are disrupting how people perceive and access the services, the mental health services, through building the Middle East's and Africa's largest mental health institution. The problem we're trying to solve is obviously a very obvious one, is that 1 out of 4 people in any given community, if they were properly assessed, they would be found to be challenged with their mental health in some way, shape, or form. And the problem with that is not that it's not diagnosed, but rather is that because of cultural stigma in our Middle Eastern and African cultures, is basically just pushed under the rug, and we would rather not talk about it due to the huge stigma to the whole community. But even moreover, as a man, growing up, struggling with my own mental health was a very big challenge for me to speak up for it and reach out for help. So what we tried to do is that we have built a product that we launched to the market 3 years ago, which was a marketplace. Like the MVP that we built was a marketplace of a mobile application that has a way to, next, where someone can find the right therapist and connect to this therapist, pay as you go, and have a telehealth consultation with the therapist. Much more than that, we have managed to build the first, next, أسرع. تمام. Much more than that, we have built the first text-based service for mental health support, as well as groups, webinars, different resources and programs that someone can utilize just within our mobile app application. And what we've achieved so far since we launched 2.5 years ago is that we have more than 170 of top-tier therapists that are working exclusively as a part of our network, who have done more than 25,000 individual one-on-one 50-minute sessions, as well as 25,000 employees that are covered with a very unique B2B2E model that we have built. And we have more than $700,000 US in annualized revenues. The B2B model is one of our most significant value propositions, which is basically stands out as the first and only one in the region that offers this kind of service to employees, where insurance does not cover mental health services in any way, and that's why we work directly with companies. We have a very long list of companies that work with us with these services that include online sessions and one-on-one sessions, as well as webinars, employee hotline, and other services. Some of these companies have like some banks, international companies in Egypt, in the region as well, covering thousands of employees with these services. And for us as a company, this means like very high retention and stickiness with these employees that are completely covered with these services through their employers. We already see traction in the number of registered users, as well as revenues and number of sessions. We see exponential growth. We see a very high retention rate, very similar or even better than physical clinics, because it actually works and it is destigmatized. Okay, what we're doing right now as an inflection point in our company is that we're expanding dramatically in different countries. We have local partnerships, we have insurance partnerships that are allowing us to create the very first insurance add-on to a healthcare policy that covers mental health. Unfortunately, this is not available yet in Egypt, but in other countries like Kuwait, for example, and Qatar. We also have amazing, very unique partnerships that allow us to unlock whole communities through very special service providers and HR platforms that do loyalty programs for employees and so on. Globally, there has been over 10 unicorns that grew into a unicorn, a $1 billion valuation company in the mental health space. Currently, we have raised only $2.1 million in capital, but this has been the biggest round that was raised in the whole of Africa and the region in a mental health startups. And we believe that we are working into a trajectory that will allow us to go into being the next unicorn that comes out of this region to solve the problem of mental health. Thank you.
Just in time, thank you. Thank you, 07 Therapy. Up next is Optwell International.
Okay, good afternoon, everyone. My name is Dr. Ismail. I'm a PhD scientist with a background in medicinal chemistry and biochemistry, and I've recently started a small manufacturing company in my hometown of Pietermaritzburg, South Africa. We offer natural solutions for problems such as joint pain, gut health, and mobility. Currently, we sell our range of natural health supplements online, both B2B and B2C, in order to pursue a larger ambition, and that is improving health span, lifespan with AI-incorporated age reversal technology. Next slide, please. Aging is a natural phenomenon and can be measured in various different ways. We're all used to chronological age, which is in years, which is the amount of time that you spent on Earth in years. However, age can also be measured biologically. That includes telomere length, which shorten as you age, and also DNA methylation. Through these means, we can tell if people are aging steadily or at an accelerated pace as compared to their chronological age. The average age in developing nations is increasing, and it is estimated that by the year 2050, there will be nearly 2 billion elderly people around the world, with almost 80% living in developing nations. This will be a massive burden on economies, healthcare systems, and social services. Age acceleration is very common in the modern world, and this is one of the reasons why so many younger people have major health issues. It is directly linked to the onset of age-related diseases, and slowing it down has shown to improve the health span, lifespan, and quality of life for people of all ages. In the past 3 years, however, clinical pilot studies have shown that it's possible to naturally slow down biological age and even reverse it. This includes methods such as temperature fluctuation, hyperbaric oxygen treatment, various health supplements, and calorie restriction, either alone or as combinatorial therapies. Next slide, please. At Optwell, we've already proven to deliver. The company has a database of clients who have purchased natural supplements from us in the past 3 years, from all around South Africa. We now intend to leverage on our reputable brand by offering clients optimized natural protocol for age reversal, which will ultimately better maintain their health. This is a more effective solution to what they're currently being provided. And this will be in the form of a longevity center, which perhaps could be franchised in the future. Our team members include myself as an entrepreneur and scientist who takes on the majority of the responsibilities, as well as a graphics designer and marketing expert who work for the company on a part-time basis. Next slide, please. We've recently established a collaboration with Prof. Caroline Nisler at the University of KwaZulu-Natal. She is a professor of biochemistry and the academic leader of biotechnology in the School of Life Sciences. Together, we intend to optimize the protocol for natural age reversal through observational studies and biochemical studies. Optwell is also incubated by Uvu Bio, who provides strong mentorship support and access to world-class laboratory facilities. We also have partners with the Natural Health Center in Pietermaritzburg, who have specialized equipment available for research, such as a hyperbaric oxygen chamber, which is quite costly. So far, we have created an in-depth business plan. Oh, next slide, please. We have created an in-depth business plan. We've also validated our research proposal. And together with UKZN are in the process of submitting an ethics application for conducting the actual research. Our next steps include securing funding, opening a pilot center to the public, and publishing in peer-reviewed journals to improve the credibility as well as advance this new field of science. These processes will also lead to the development of a unique clinical database, which when combined with AI technology could potentially offer optimized age reversal protocol for people of specific demographics. This technology will be of great interest to insurance companies, lifestyle rewards programs, and other companies who profit from keeping people healthier for longer. Next slide, please. Having started Optwell by bootstrapping with no capital or funding, I'm very proud of what's been achieved in the past 3 years. I hope that we can now raise some funds to further our innovative ambitions. Thank you very much for listening.
Thank you, Optwell. May we now have Pharmacy Marts on the stage, please. Are we ready? Okay. Here we go. 5 minutes. Good luck.
Thank you. Hi, I'm Ahmed Qadoos, CEO and co-founder of Pharmacy Marts. I've been working in the pharma industry for the last 14 years. I worked at Pfizer, Novartis, and Takeda recently as head of market access. So as we speak, so currently 1/4 of the population globally have no access to medication. Mainly we are talking about emerging markets. If you are talking about Egypt, Egypt's the largest market at Africa and considered a center for manufacturing at Africa and Middle East, with the largest and the fastest growing market at Africa with $5 billion market size. Yet underneath the pharmaceutical supply chain, it is fragmented as well as underfinanced and unautomated. We are talking about more than 60,000 pharmacies and more than 2,000 suppliers and wholesalers. All of this is considered as a burden on the pharmacists to do their daily work, from doing the procurement, so they have to deal with multi-channel sourcing, consuming from 2 to 3 hours per day to do the procurement, as well as they have scarcity in financing as they need to pay for their purchases cash on delivery, as well as having challenges in the fulfillment and delivery of the products, as some of the suppliers don't even provide delivery service. Our solution, mainly, it's an end-to-end B2B solution for the pharmacies, from a marketplace connecting suppliers, wholesalers, as well as manufacturers with the pharmacies, as well as the other arm is inventory financing. Mainly, we're talking about financing from banks, microfinance companies, as well as our third arm, which is a delivery service, delivering the product same-day delivery, as well as we have the option of, let's say, if it's a chain pharmacy, the pharmacist can select which branch he wants to deliver the product to, as well as select the delivery time. This is a screenshot of our platform. It's very easy and crisp user experience. He can search for whatever medication, have a live quotation with the best prices, add it to the cart, select the payment option, and then select the delivery address as well as the delivery timing. For the financing part, currently we created a comprehensive financial railway for this sector in partnerships with different banks, microfinance companies, as well as payment facilitators to avail financing for pharmacies for duration up to 6 months, as well as to access to financing up to $60K US. Our real value proposition, which is saving time for pharmacies, which is 30% of their daily time, as well as extending their payment plans, more access to shortage medication, which is improving patients' access to medication, as well as increasing their profitability by 17% versus the conventional ways. Currently, we have been operating for 2.5 years, mainly covering the key cities at Egypt, Cairo, Alexandria, Giza, and Delta, with cumulative GMV over $6 million US, as well as acquiring more than 7,000 pharmacies, as well as reaching more than 2,000 pharmacies as active base on monthly basis. On the other hand, our acquisition strategy, mainly it is dependent on omni-channel engagement, either through the sales team or through the digital channels to acquire the customers. So this is a screenshot or view on our different, let's say, tech products. All it's built in-house from the marketplace, web-based, as well as mobile apps, as well as some internal optimization app from the sales app, as well as we have a delivery app in order to ensure that all the supply chain is truly digitized. So currently, as we're speaking, we are starting with Egypt. Egypt is our starting point, but yet the, let's say the issue as mentioned in the emerging markets, it is 310 billion market size. We are co-founders coming from different verticals, from pharma, from operations and sales, from pharma, as well as from fintech and telecommunications, as well as from tech backgrounds. Our real value or real impact, currently we are improving access to population of 30 million person, as well as supporting pharmacies to do their real role, which is supporting patients, supporting pharma companies to ensure that there is no shortage of the medications in the market, as well as optimizing the pharmaceutical supply chain from 1 week up to only 4 hours, as well as currently we are employing more than 150 employees. So at the end, there is 2 billion people globally are having issue with access to medications, and we are changing this. And thank you.
Thank you, Pharmacy Marts. We'll be moving on to Rology. There we go. Whew. That was a tough one. Very good. Rology. There we go.
You can imagine I cannot say R. Aldar. Rology. Okay. Thank you so much. First of all, can you imagine in 2023, and we have 2 out of every 3, they don't have accessibility for diagnostics. They cannot have a proper diagnostic report. Whatever, it's in a good time, good quality, there is no accessibility at all. So this is the problem we are solving in Rology. So we solve the problem of the severe shortage and the misutilization of radiologists. And our main focus is in MEA region, Middle East and Africa. So in Africa, you can find only 1 radiologist for every at least 1 million citizens. And when you think about, or you look about the WHO numbers, it will be, should be actually a 1 radiologist for every 10,000 citizens. So there is a huge gap, and this is what we are trying to solve. And this gap, it's causes a high latency in medical reporting time, and also a lack of diagnostic services. So we solve that through an AI-assisted teleradiology platform, which is, and this is a secret sauce, as we can say, with a 0 setup cost. So the hospital or the radiology provider, they don't need to have any kind of infrastructure, any kind of expensive machines, expensive servers, any kind of that. Literally 0 setup cost, and they can be automatically integrated with our platform. So we can integrate with X-rays, CTs, MRIs, and we do this integration in maximum 20 minutes. So in a 20 minutes, the hospital can be automatically integrated with our platform, and once it will be integrated, they can have a final diagnostic report authorized with a very high quality in maximum 2 hours per scan. So out from zero accessibility, it goes to have a final diagnostic report in 2 hours. So how we can reach that? We can reach that through the combination between the human skills, the radiologist, and the AI. So we're using the AI, using our platform as a single point of integration, and then we combine the modalities and the AI with the radiologist. So we empower the radiologist to do more scans per hour, and also to select who is the optimum radiologist to work on such a scan overall. We have been in the market for 5 years, and until now we are proudly helped to save more than 600,000 lives in 9 countries. We started in Egypt, and then we scaled it to East Africa, mainly in Nairobi office, and we are scaling right now to West Africa and Nigeria. We have also, just 2 weeks ago, our office in Saudi Arabia. Yeah, it's not 50 clients, it's 150 clients. But also in the last year, we did a growth of 670 in Kenya, which has give us the ability to provide the final diagnostic report for more than almost 30% of the population in Kenya overall, and this is something we are very proud of. At the end, I think we have only 1 minute, so this is our main solution. It's not about the product, it's not about how do we develop it and so on, but it's mainly about the DBD. So we do the decentralization through our platform, so it's a zero setup cost, there is no need for any infrastructure and so on. So literally, any hospital at any place can integrate it automatically with our system, and then because it's a platformalized, so we can provide all of them with the same quality level, and by the end it's democratized. So wherever you are, you will have the same quality, which is medical quality, which is everyone have the right to have. So thank you, and I'm really open for any questions.
Thank you so much. Pardon? No, there's no Q&A. Thank you. Thank you so much, Rology. I think I've got it now. Let's hear from Simbona Africa. Simbona Africa, tell the people what you're selling.
Thank you for this opportunity. Simbona Africa is a medical device designing and manufacturing company based in Ethiopia. Currently, we are developing different medical devices. Now I'm going to pitch about affordable infant radiant warmer to prevent neonatal deaths due to hypothermia. Those are Simbona's medical devices, which are designed in Africa and manufactured in Africa. Currently, these 3 machines are in use in Ethiopia. We are looking for to reach more African countries. This is a baby warmer, phototherapy machines, and UV sterilizers. Next page. When we come to the big challenge, the grand challenge in Ethiopia and in Africa, globally, there is 20 million babies born with hypothermia. Among these, 4 million of babies die due to premature births and infections because of they cannot regulate their body temperature since they are low birth weights. So when we take the UNICEF report of Ethiopia, nearly 240 babies will die each day before reaching their first months due to hypothermia. So totally, this hypothermia or enabling of regulating their body temperature accounts for 22% of days of new 15 UNICEF reports. In Ethiopia alone, there is also an education of baby warmers in hospitals and health centers because of two things. First, they are not affordable. Second, there is subsequent failures of machines and health facilities. So, Simbona, to solve this grand challenge as a continent, we are developing affordable infant and warmer, which are solar powered. It has 2 years warranty, clinically effective, and free maintenance for those who are using Simbona's medical solutions. When you see, currently our product has passed all Ethiopian Food and Drug Administration regulatory requirements. Its clinical performance test was conducted under